our health coverage. We don't know when unexpected events are going to happen or illnesses that arise. We need the coverage. I think it's wrong that we are placing a mandate and possible penalties on a necessity of the American people. But what I've come up with is some recommendations of change. My first recommendation is to move and or extend open enrollment. To extend the open enrollment period, this, I believe, would give the ability to drastically improve the financial aspect for both the insurance carriers and the individuals looking to purchase health care coverage. On the other side of the PowerPoint here, the possibility for improvement. By implementing a new time frame during a time of year that is proven to be monetarily stable and not known for high stress intensities, this should encourage the American people to make the best decision in purchasing law-enforced health coverage. I do believe it would help to move the open enrollment period out of the holiday season. Money is definitely of the essence for most families. Increased spending, not enough time, and with those stress factors, I don't think it's a good environment, a good setting for anyone to be making any type of decisions that could affect them for possibly a whole entire year or more. Also, with moving and or extending the open enrollment, this also has the ability to increase the sales of individual health plans. When you have an individual that has a clear mind and feels confident in their purchase, they're going to want to purchase something. They're not going to have such a pullback on trying to purchase something so necessary and even mandated by the law. Another possibility for improvement is creating a financial balance between the needs of the American people and the carriers. My second recommendation is to adjust the amount due for health coverage to coincide with the individual's annual income, if not forever, for a transitional period. What I believe this would do is stabilize the insurance market by increasing and maintaining insurance sales. By considering an annual income, this would initially start the process of possibly creating a financial plateau to stabilize the purchase amounts and eventually decrease the need for insurance carriers to maintain such high costs, making healthcare coverage a more manageable process for the American people. The action plan that I have comprised to go about carrying out my recommendations would be this. Create an open enrollment time frame, possibly taking place from January to June as a suggestion. Initiate a transitional period of accepting new enrollees for individual purchase based on the calculation of annual income. Create a stabilized insurance market. Equalize pricing of company and individual plans purchased. Establish financial plateau. Overall, I believe that this would provide affordable, quality health care for all Americans and reduce the growth in healthcare spending. In conclusion, I believe the goal is not to completely dismantle the process or progress, I should say, of the Affordable Care Act it's made, but strengthen its possibilities for success. Fundamentally, the structure of this law was created to better the lives of the American people by creating a way to provide affordable, quality health care while reducing the growth of healthcare spending. So realistically, this expectation is going to take some time to implement properly. But I believe that the Affordable Care Act is worth waiting for to perfect. We had to start somewhere. I believe it's a wonderful law. We do need to take care of our people, and this is the way to start. We just need to tweak and make the policies a little bit more friendly, manageable for both the insurance carriers